Okay.
Sharon, when I came in, it did say it was being recorded.
It did?
Or did anybody else get that message?
Yes,
Yeah.
Well,
it says it's recording now, so
it for sure is now. So, okay. Thank you, Cassandra. I'm sorry.
So so I just I've gotten some domains. I have not actually signed up for the LLC, which I plan to kind of do. I know that I can't quit my job right away, and I plan to go to the senior center and just kind of inquire if there's anybody out there that's really what their interests are. Is this something that would work in my area? Just to kind of feel it out, not like I'm in business, but what do the people think if I did try to go into this business? But my thing is they're going to want to know how much. That's the big thing. How much, how much, how much, right? And so I thought, okay, well, I could do a test patient. I could just kind of, okay, I'll pick a couple of you and I'll just follow you and take care of you, and see how it goes. But I would like to know how to charge,
Yeah.
if I should do packages. I want to, everybody says that this is needed. Anywhere I go, oh yeah, that's really needed. But a lot of the people say nobody's going to pay for it.
Okay.
They're just not going to pay for it. So can I get codes and bill them to Medicare, Medicaid, uh, and then assessment tools, like your basic assessment, vitals, what's your concerns, what's your goals? Is there like a form a cheat sheet that I can just print off?
Yeah.
Okay.
These are
I know
great
that.
questions.
Am I asking way too much?
No, you're not.
Okay.
Because I'm going to answer all of it. And so let me see, but I have a little trouble remembering the very beginning. First, I want you to know you've got a great idea. Don't let anybody else tell you that you're not going to get paid or that nobody will pay for this. People will pay for this for sure. Not everybody, but there are people that will pay for it. You will have a challenge in that not everybody has heard of this kind of a service before. So when a service is brand new, it takes educating the public a while. And that does make it a little bit longer sometimes for you to start making money because there's a longer lead in, but there's ways around that. So let's see. There are no codes in the insurance companies that I know of right now that would pay you for this. You'd be looking at out of pocket. Okay. And yes, your policies and procedures and your forms and things like that would be very important. Your consents that you have people sign, very important. But the quickest way to start a business like this, well, let me go back to pricing because I heard you ask about that. I recommend that do you live in a city or a town or a rural? What's kind of area?
Pretty rural. Yeah.
Cassandra, did you say that you're in Minnesota?
I am.
Okay.
Minnesota. Bemidji is the closest town, if you know Minnesota. I am 4 hours away from the Twin Cities.
Okay, so you're pretty far up. So pricing. This is my first approach to pricing, and I hope this is helpful to everybody because we all have to figure out where to start with our pricing, right? It's a big question. So what I suggest is that you look around your community at other professionals and see what they're charging. You want to position yourself as a professional service, just like a counselor, like a marriage and family counselor. Well, what kind of other professionals in your community would you say you might be providing similar value to?
I don't think there's anything in this area besides like home care. Uh, yeah, I don't think there's any services that will be like that.
No, there
Private,
won't, yeah,
yeah,
you
yeah,
won't probably find anything that's like this. You're going to be
Mhm.
unique in the marketplace when you emerge. So you're not
Right.
looking for someone just like you, but another health professional who's working in personal health services, and not something mechanical like dentistry. That wouldn't be really
Yeah.
that similar to you. I'm thinking more like marriage and family counseling, or
Okay.
what else would you fill in that blank?
Massage, Reiki, that kind of thing.
Okay.
I,
You can start with that because that's pretty ubiquitous everywhere. You can start with that, but then later, if you think of other higher level people with degrees like you do, professional degrees, that would be a better match. Let's just start for now with massage and body work, Reiki.
Mhm.
What do those people charge?
I have no idea.
Okay.
I'll have to look into it. But I make really good money right now, so that's really going to be hard. But the whole problem is I want to get out of. I want to have my own time, so
Yes.
that's why I'm doing this.
Yes. Well, what you're
So,
describing is a type of service that you could easily start on the side,
mhm.
and then grow it sort of grow that as that grows, shrink your other work so that
Yeah,
you're not making a
maybe.
giant leap off of a cliff and hoping that you land
Well,
safely.
I work for the federal government, so I have to take a giant leap. There's no, you work full time or you don't work at all.
Okay. Well,
So
I
that's going to
understand.
be hard.
Okay.
Um,
So I have two other suggestions, and then I'm going to wrap it up to work
okay.
with somebody else. The first one is to see is there a hospital in your community?
Yes.
Okay.
Sanford Hospital.
Does it have case managers or some other nurses that work with discharge planning?
Oh yeah, there's discharge nurses. Yeah. I
Okay.
did notice that they just June 1st posted for a nurse case manager position. Otherwise, I don't think they ever had one before.
Interesting.
Yeah,
Okay.
it is interesting.
Okay. And so I suggest you talk to the people that are doing that kind of work, even other nurses in the hospital, like unit managers or whoever you can get and network with these people and ask them if they see a need for the kind of thing that you're talking
Yeah,
about. They're
yeah,
going to
and I
say
know these
yes.
people.
Yeah. Okay.
So,
And you know them.
mhm,
Okay. This will
mhm,
greatly shorten your runway
mhm.
from where you're starting to where you can really have a business. Network with them, let them know what you're thinking of and how you would like to help people, and ask their input on how to design
Yeah.
the service and how to reach the
Okay.
people. Okay, that's
Okay. Sounds good.
yeah. And
Sharon,
then
can I-
one more thing I want to share with you, I'm going to put it in the chat. There is a nurse. Oh, wait a second. There's a nurse I know who works with this exact thing. Oh, I'll have to go back to her website and get the URL again. But Karen Sanders is a holistic nurse. She has developed a business specifically to teach nurses how to be patient advocates. And she has all the skinny on the
Mm.
forms and how to do it and how to
Ooh,
build your business. And so you might want to look at her up. And so let me just
okay.
grab her
Cassandra, if you
QR.
want to check me out, send me to Leanne at onceanurse.com. I just met with a nurse that wrote a book on something along this line. And then I've also, on my podcast, I interviewed a nurse that was doing this kind of thing. She was setting up similarly a business with this idea. But if you're looking for clients, go to nursing homes where the family lives far away. they need somebody who will do this for them. And many of those people are willing to pay for it because they can't be flying home for, mom or dad's challenges, and they don't know where to go.
Wow.
That's
That's
excellent,
exactly
Leanne.
what I visualize. I visualize mom being here, son living in California, and he wants somebody to be watching over his mother's care and healthcare. Yeah.
And that's worth a lot.
Yeah.
I just had my mother, be ill and pass several states away, and I literally needed to go and be with her. But if I had somebody like you there that I could have worked with, that could have been very helpful.
Yeah.
And,
Well, thank you so much. I appreciate you very, very much.
You're so welcome. And Leanne, thanks for
Sure.
Yeah.
adding
Thanks, Leanne.
You're welcome, Cassandra.
Thanks.
And Maria, Jan, and Teresa, as a lot of times the four of us, everybody, the three coaches and I will co-coach people a lot of times. And so if you all have things to add tonight, just go ahead and put them in the chat for the person that I'm coaching, because we have such a big group here tonight. And this might be a good time for me to let you know that the first Tuesday of every month, Jan and Teresa and Maria and I offer a free business coaching hour by Zoom. And we'd be happy for you to come and bring your questions, your challenges to that Zoom as well. If you signed up for the summit, you'll be on our mailing list now. So you'll receive an email before the first Tuesday of next month. And in that email, it will give you the link to register for the call. Okay, I think we have time for another one. Who else would like to receive? Oh, here's one from Leslie and Taylor are both here. Let's see what Leslie says. She wants references for lawyers to start a primary care with state compliance, medical, or what to expect to pay for a lawyer. Okay, I do have somebody I could recommend. His wife is a functional medicine physician, and he has developed his law practice to specifically focus on physicians, nurses, and other healthcare practitioners in private practice. I don't want to look it up right now, though, Taylor. So if you would put your email address in the chat, I'll get back to you tonight or tomorrow with that reference. Cassandra, oh no, that's another one. Taylor in Ohio would like some advice or suggestions on how to approach a doctor's office or hospital unit. So Taylor, would you like to unmute and tell us more about what your situation is? Hi, Taylor.
Yes, hello. So my situation's kind of unique. I graduated INCA last July, but I was born with a rare liver disease, and I think it was not even a full 2 weeks after I graduated INCA, and had already planned to I already had a whole bunch of stuff up and going for my business. Then I got listed on the transplant list. So fast forward to now, I had my transplant in April, so that's awesome. But I realized the need and the big gap between being, well, I guess not gap, I guess. So I just know that I have a lot to offer being a lifetime patient plus an ICU nurse during COVID, and just how much this system is really broken and people are just kind of forgotten about. And so I went, and I've always kind of wanted to help with transplant stuff, like liver patients specifically. And I've kind of mentioned to my surgeon and the nurses and everything that I've been working with as a patient, but I don't know how to approach it because I haven't been working in a hospital or bedside for almost 2 years now because of my liver. So I just didn't know if I guess I just need I don't know, any tips or suggestions on that, I guess. I'm kind of all over the place, as you can tell.
Yeah, that's all right. Well, so you've been working in ICU, and tell me about your community. Is it city, suburb, rural? What's your
So
situation?
I live very rural, and I'm about an hour south of Columbus, and I had my transplant at Ohio State, so that's kind of where I've been involved. Um, so yeah, but where I am is very rural. So
Okay. And is there a hospital near you?
yeah, there are a few, but I'm from Central Ohio, so I'm not very familiar with hospitals down here.
Okay,
per
so
se.
when you were working in the hospital system, it was more central
Yes,
Ohio.
yes, yeah.
Okay, okay. Um, are you still in touch with any network up there?
Yes, but I worked at a different health system than Ohio State. So I kind of wanted to get on with like Ohio State just because my experience was so great. And I have asked about like being a nurse coordinator. Um, but they don't have any openings right now. So I was like, I think I might just need to wait for that to happen. I don't know. I feel
Yeah.
like I'm just kind of jumping the gun a little bit, but I also just was very I just don't want to go back into the healthcare, like into a hospital bedside because I feel like it's extremely toxic. And I saw how toxic it was even as a patient. Um, so that's kind of my big why of wanting to go this route. So
Yeah, yeah, I understand. Well, were you on this call tonight when I talked to Coach, the very first person
yes,
that had the baby?
yes.
Okay. So you heard me suggest that she get out and just talk with people and listen to them with empathy for their situation and learn more about what their problems are that are keeping them up at night. That's kind of
Mm-hmm.
the way I like to phrase it, because people are most likely to pay for problems that are urgent or really on their mind that they have to solve, like right in front of them. In some times that can be that they want to prevent a problem down the road, but that's usually they still have heightened awareness because maybe somebody in their family has had the serious problem and they could
Mm-hmm.
see themselves going that road, so they don't want to, they want to
Mm-hmm.
prevent it. Either way, there's an urgent type of problem. And the problems that you have lived with, as I heard you call yourself a lifelong patient. Yeah. And I'm sure you've talked to other families and other patients, so you've probably heard a lot of the kinds of problems they are struggling with. But you might not have listened with the ears of an entrepreneur. So I suggest that if you can spend time with people, and there might be like a Facebook group. Do you do any social media?
Mm-hmm. Yes.
So you might want to get in some groups with the people that you think you might want to serve and just listen and chat with them in the group just about what their problems are, what they've tried before, what worked, what didn't work, what's the form of the solution they'd like to have, using the curiosity of a innovative nurse entrepreneur, which is a little different than being in rapport because you have similar problems. Now you're looking at it, from another lens. And along with that, if you can remember that, and this is, I think, I want to say this to everybody, that when all of us, myself included, when we describe our problem, if we don't already know how to solve our problem, then we aren't really describing the problem. We're describing the symptoms of the problem. Okay. And so nurses in our education experience, we can often hear the person telling us about the problem and we can recognize, oh, they have symptoms of a bigger or a deeper problem. And so that you want to notice that and ask yourself, can I help them not just with the symptoms, but with shifting the problem at the core or at the source? Does that make sense to you?
Yes. Yes. And I love how you said think of it as like an entrepreneur instead of a nurse entrepreneur instead of building rapport. That was like a big light bulb for me, and that really helped. So I appreciate it. Thank you.
Okay, you're welcome. The rapport will come right back. You won't be
Yeah.
ditching that, but just for this part of your journey, you want to listen for those with those ears.
Thank you, Sharon.
You're welcome, Taylor. Okay, I know we've had some more people come in. And coaches, do you have any more suggestions? I might
Yes, I
have time to
think
do one more coaching.
Sarah S., she said her challenge would be limiting beliefs. I think that might be kind of fun to explore.
Yes,
Yes.
that would be different from the others too.
Uh-huh.
Okay, where's Sarah S? Oh, I see you're driving. Hi. Do you want to unmute? Can you
Hi.
do that?
Yes. Hi. Happy to
Hi.
be here.
Well, I'm
And
happy.
thanks for reading my post there. It's kind of interesting because as I'm listening to different nurses talk, I am kind of in one way I feel like, okay, I'm not alone because I'm also hearing like other kind of like underlying beliefs. It's not really being said, but I hear it. And so in that way, I'm like, okay, I'm not alone in that kind of feeling like that. I guess I'm kind of feeling like a little bit nebulous about this because it's more of a reflection, I guess,
Yeah,
in
that's
that
fine.
my experience, kind of looking at the professional identity or the collective identity of like nurse. I think a lot of times, well, the best hope is that we get into nursing because we really want to help people, right? We want to help people feel better. We want to feel better. And then we get into the system where we're, part of a room charge. Our services are not, are not billable currently. Although there are things coming out that I'm following.
Mhm.
And then there's some, back in the like old days, we're kind of like the doctor's handmaiden. And now it's, getting better, but we're still kind of like task masters. And it's like, wow, our skills are kind of, we all feel a little bit like, well, we're not really actualizing to our highest potential, or even what we learned in like nurse theory classes of like what nursing could be, Nightingale's vision of what nursing could be.
Yes.
I hope you guys can hear me okay, because I know it's probably loud in my car. And so when I hear things like, and I don't mean to call anybody out here, I'm just kind of repeating what was said. Things like, for example, I'll use my own example. One of the most cited reasons for why nurses don't like go on boards or serve in like politics or on panels and things is because we don't feel that we know enough to offer something. That's like a limiting belief, or
Yes.
a limiting belief of, or have you heard like, well, I'm just a nurse. Like, what can I do? It's a tremendous problem. What am I supposed to do about that? Or, I do want to charge this much, but probably people will think I'm being greedy or profit driven, but there is a need for this, and I do know what I'm talking about, or I have tons of ideas, but I don't even know where to start, or like where do I even begin? So those type of beliefs that we have, even beliefs, toxic ones, like if you didn't work in the hospital, you're not a real nurse.
Oh yeah.
Even that we make ourselves, right? Like as the profession. So those are some of the kind of reflections that I've observed, I've experienced myself in my nursing career. And I'm just wondering if you guys can speak to that, or speak to any of us who are feeling like, yeah, we know there's a problem. It's systemic and a multi-level. It's tremendous. Like, where does the largest profession of healthcare, professionals, how can we step into that power and feel confident that, like, yeah, we do know what we're talking about. We have something to offer.
Oh, I just love this question so much, Sarah. Thank you for bringing it forward.
Thank you for listening.
It's at the very core and foundation of everything we've been talking about. You're right. And, and we can work at our individual level. In my practice with coaching nurses to start their businesses, we have a lot of tools and exercises that we offer to help us work with our individual self-talk and self-doubts. But it's so much bigger than that. You know, it's profession-wide, it's culture-wide in terms of women, how we've been conditioned to think of ourselves. Also, service providers, how we've been, you know, teachers have a very similar situation that nurses do. Most people who provide a personal service are, you know, conditioned to think they're less than some others. And so it's layer upon layer, you know, is how it's happening in our consciousness. But that doesn't mean we can't work with that. We definitely can. And so we can work individually and also collectively. And one of the things that really helps is things like this, where we gather with nurses, with like-minded people, doesn't have to be nurses, but people who understand what we're talking about and who are working with dismantling that kind of conditioning that is in ourselves and in our group. So I'm trying to think what else I can offer here in this context. I'm curious if anyone else that's listening to the call has something they'd like to offer, because I think this is one of those things that when we need to hear from many voices from many different angles, what is working for ourselves and what we are up against too when we try to change things. Because yeah. So Sarah, is there anything specifically that you'd like to talk about with your case, or do you want to keep it general and broad like that?
Well, I'll give like a specific example. Right now, I am working with like not a nurse coach, but just like a general coach. Actually, it's offered through my employer. And I said, well, okay, I want to do this nurse coaching thing, but I'm a little bit afraid. And part of that fear is like, what if I go out there and I really look like just how I feel, like I'm kind of like stumbling my way through it. I look disorganized, or someone's, you know, I get attacked for, you know, offering a, you know, kind of, you know, I don't want to be like disruptive, but, you know, we know the healthcare system's not working. So, you know, if you put yourself out there on social media, for example, it's kind of a silent agreement that you're opening it up for public opinion, right? You're putting it out there. So I said, well, okay, well, I'm not ready to start a business, although I know a lot of like nurse coaches, they go through the program, they start their business. I don't want to do that. There's some promising things at my job. Okay, how about I just start creating content? What if I just raise awareness about the nurse coaching specialty? I already know there's a bunch of people out there doing it. At the same time, I still find a lot of nurses don't know about it. Never heard of holistic nursing, don't know about nurse coaching. And then just give my own unique take on it. Mm-hmm. So that's I'm kind of like exploring like the content creator thing. And I'm like, I got to learn how to do YouTube or how to like streaming and live, right? I don't know that. I think my experience of nurses is we're not like the tech people, but we try our best.
Yeah.
So I guess one of my limiting beliefs or kind of my fear is like the fear of like backlash or criticism, or that I'll look, I don't know. I do know a lot. That's the thing. I'm like, I know I do know a lot.
Yes.
Or maybe that it's just like, I'll just be repetitive and redundant, and my idea will just be like, yeah, you know, unoriginal, or those are things I think about. Yeah.
Those are all really great examples of the symptoms of the problem, you know, and the problem that you're describing that comes from that lack of confidence. And it's not that something's wrong with you. It's that there hasn't been a lot of people validating you for your ideas and your approach that you want to take. You know, you're not seeing it in the media, you're not seeing it in the places you go. You have a vision for something new that's possible and positive, but it's not being validated anywhere yet, or at least not often enough. And so it's no fault of yours that you lack confidence in something that you have not been validated in over, you know, repetitively. That's one part of it. There's many other parts of it. So one of the things we do that I like to use myself is just when I have, well, let me also say, every entrepreneur that I know of, even ones that aren't nurses, struggle with imposter syndrome and self-doubt and wondering if they're good enough and having thoughts like, who am I to be doing this? Okay. And then nurses have the added cultural conditioning of, we're not supposed to charge money. We're supposed to be very humble. We're not supposed to talk about ourselves even. You know, I was trained, you know, if you go in a patient room, you don't even talk about yourself. You only focus on them and their needs and all that. And that's, of course, for good reasons, but it's a huge shift for us to leave those habits and ways of thinking behind and begin to show up and stand in our power with our love and intelligence, all three connected. And so one of the things I do is when I hear those kind of sabotaging self-talk voice in my head, I've learned to just pause and take some breaths and acknowledge that, yes, I'm having this thought. And then look at that. Look, I use my imagination at that point to just imagine this little part of myself. It's usually a voice coming from a younger part of ourselves that's afraid that we'll get in danger, or that we're going to do something that'll, make us look foolish or hurt us in some way, right? And so there's nothing wrong with having that part of ourselves. It's a part of ourselves. We don't want to kick any parts. As a holistic nurse, my belief and my approach is it's not good to kick any part of myself to the curb or shut it down and try to push it away, or worse yet, shame it, or anything like that. So I take the approach of listening to that voice and then asking, what do you need? I kind of then have a conversation between my adult current self and that younger self and say to the younger self, what is it you need? I hear you, and what do you need? And with that kindness toward that part, it usually can tell me, and then I, as the adult that's in charge, can say, okay, well, thank you, and here's how we'll incorporate your concern, and here's how we're going to go forward next. And then I can go forward. And it's probably took me longer to describe it to you than it actually takes in practice once you've done it a few times, So I see you smiling. What's your response to that idea?
I guess what I'm feeling is that in the things that you've said, one, I think it's funny that you call it the liberated nurse, because that word comes to mind, just in all the conversations we're having about how do we liberate ourselves into actualizing into our highest potential. But also a lot of the things you're saying, I guess it's reassuring that, actually you do know what to do, and you just need to do it. You just need to practice it and do it.
Yeah.
So thank you.
You're so welcome. Well, we have just down to a few minutes left, and I would love to hear in the chat if this has been useful for you. Any takeaways that you got that were of value to you from this conversation. And also remind you that tomorrow night we'll be here the same time, the same link, and have the same conversation. We'll start with takeaways from the day. I'd love to hear what was meaningful to you from what the interviews that you saw. And so tomorrow we can talk about things you saw from day 1 interviews and day 2, okay? Because all the interviews are available for 48 hours. So for those of you who have come in late, I wanted to repeat that. The interviews are available to you for 48 hours, unless you get the all access pass, and then you'll have the access to them for a year. And also in the all access pass, you get the audio recordings too, and a couple of bonuses that we've thrown in too. So I see that Linda has her hand up, so I'm going to take Linda's question. But while I do that, again, feel free to put in things in the chat that you got from the call, and tell us if you'll be here tomorrow night too, if you think you'll be here. Okay, Linda, I'd love to hear what is on your mind.
I was just responding to the individual that made a comment earlier. What I do when I have these limited beliefs and thoughts, I think about the time when I was the first nurse and I was scared of everything and how like I overcame the things that I had overcame. And I think we have to remind ourselves of the past, because yes, things bad can happen in the past that not necessarily all the time traumatized, but it made it difficult or become a learned behavior to be afraid of things. But we have also overcome things. And I think about, all the different things. And I'm like, okay, that was very difficult. And right now I am currently pursuing, I have my LLC. I have a little bit of a setback in my business, and that I have to think of a whole new name because I want to trademark it. And I've been stuck, and I'm trying, and it's hard for me because I'm like, oh, why am I stuck? I got a timeline, and I was like, no, you're gonna get this. It's gonna take some time. You came up with a really great name before. It's just gonna take some time. So I think it's important to remind ourselves, hey, I've done hard things before, and
Yes,
sometimes maybe writing it down, putting it in a book, so whenever you have those times, you go back and you read it to yourself. So that's just my recommendation.
Linda, that is beautiful. Thank you so much for sharing that with everybody. I think that's really valuable. You're getting some hearts in response. Okay, well, I think that we'll close on time, and I welcome you all back. Oh, wait, excuse me. I want to say something to Linda. Linda, if you'd like to bring your challenge to our first Tuesday call, our group is pretty good at helping nurses brainstorm on their business names, taglines, things like that. You might get some good ideas. It's just coming up around the corner the first Tuesday of July. Okay, so, and it's at the same time. It's at a different link though. You do have to register for it through our website. I guess I could tell you that. So on liberatednurse.com, in the nav bar at the top, there's a place that says business workshops. And then if you click that, then the first thing on that page is invitation to sign up for the first Tuesday business coaching call. Okay.
Thank you.
You're welcome. And that's open to everybody. Okay. Thank you so much. I'll see you. Hope to see you tomorrow night.
Good night.